Good morning, everyone. Today we're going to be talking about how we would function as a manager or as a leader within an organizational structure. After completing the leadership questionnaire, I scored very closely in all three categories. I scored the highest by only a couple points with the interpersonal skills. I feel this is fairly accurate. I do communicate and interact with others well. I'm pretty optimistic, calm, and confident. But also, I feel you need to be administrative to organize, plan, schedule, make sure everything's properly staffed. In addition, conceptual skills allow a manager to visualize the entire organization and work with ideas and the relationships between abstract concepts. After reading Chapter 7, there were some skills that I identified with in leadership. I feel I would follow the traditional management functions. Planning, organizing, coordinating, and directing. I figure all these are needed for an efficient manager. Also, figure out the need of the organization while keeping in mind what kind of staff we already have. Looking at staffing problems, offer input for change in hopes of staff retention. I'm also a big fan of peer-reviewed interviews. I feel we are a team. We need to make sure we all have similar personalities and that the new hire would be a good fit with the rest of the staff. As for the published literature, I feel I would determine if the organizational structure is vertical or horizontal first, and if it includes a matrix structure and who I need to communicate with. Explore if and how the structure facilitates, impedes, or does not allow for the use of care modules that include transdisciplinary collaboration. And make sure to understand between each level of management and determine if there is any relevant or social factors impacting the situation. Determine the variety of experience and educational backgrounds of all the different positions available, and determine the goals of the organization or a nurse division with financial limitations of the organization. We were also to identify the levels and departments that we would need to work with in order to be an effective role. I would need to work with all the clinical nurses, clinical supervisors, discuss the goals and plans of action with the nurse manager. I would determine what is expected and what I can do to attain the desired outcomes. I would talk with other managers and supervisors on different floors and to see what they've done in the past that's worked or what's failed. We were also asked to explain if we feel you'd have a preference of a vertical or horizontal structure. And I would use both. I feel the vertical, there's a well-defined chain of command within the vertical organization, which I feel is a need in most organizations, especially during emergency situations. In addition, vertical structures, each person is responsible for specific areas or set of duties. Within the horizontal, it puts more power in the hands of the employees, which I feel is a good thing. It can increase employee satisfaction. Employees in horizontal organizations may have a stronger sense of identification within the company and feeling like they're part of a team. It puts more power, like I said, in the hands of the employee. And within the horizontal organization, they may have a stronger sense of identification with the company, and they may, again, it's all about teamwork. As for a model of care I would use both functional and team nursing. Functional, it's a good way to deal with multiple levels of caregivers, your doctors, your MPs, your PAs, your RNs, and your techs. Each caregiver performs certain tasks while keeping with their education and experience and staying within their scope of practice. The team approach to ensure that there's a good mix of experienced RNs with new hires, so hopefully we can provide safe and effective care. But I look forward to your response, and I hope everyone has a great week. Thank you.